Yeah, hi everyone. Welcome to my YouTube channel. My name is Dr. WAN. Today we're going to talk about insulin resistance. What is it actually? And how can it be treated? Insulin resistance may be downstream of mineral-driven redox and oxygen dysregulation, not simply excess carbohydrate or adiposity. Insulin resistance is usually explained as a failure of glucose disposal driven by excess calories, excess carbohydrate, or increasing fat mass, as you can see on the profile picture or profile image. That explanation doesn't sit comfortably with what is seen in practice. Insulin sensitivity can improve without meaningful fat loss. Weight loss often stalls despite strict dietary adherence. Hyperinsulinemia frequently appears before, not after, overt metabolic disease. At the cellular level, insulin is doing far more than lowering glucose. It is a stress-responsive hormone that adjusts redox balance, substrate use, and intracellular metro handling in response to cellular load. Now, insulin signaling increases cellular ion uptake, including in adipose tissue. Iron is essential, but it is also highly pro-oxidative. When iron accumulates within cells, mitochondrial respiration is impaired, fat oxidation decline, and reactive oxygen species increase. In that context, insulin resistance begin to look less like a primary defect in glucose handling and more like an adaptive response to a stressed cellular environment, one characterized by excess oxidative load, inefficient oxygen utilization, and declined mitochondrial capacity. Mineral regulation sits upstream of this process as a core metabolic infrastructure. Copper-dependent enzymes are central to ion handling, antioxidant defense, connective tissue integrity, and cellular respiration. When this regulatory layer is disrupted through chronic stress, inflammation, altered mineral balance, or environmental exposure, ion handling deteriorates, oxidative stress rises, and insulin demand increases as the system attempts to compensate. Seen through this lens, insulin resistance reflects increasing reliance on hormonal stabilizer rather than original source of dysfunction. Treating insulin as the primary problem risks overlooking why the system has become so dependent on it in the first place. This also helps explain why improvement in insulin sensitivity do not reliably translate into sustained fat loss. Fat loss depends on the cell's ability to oxidize fuel efficiently. If mitochondrial function remains constrained and redox balance unresolved, lowering glucose does not automatically restore fat metabolism. Weight regulation is therefore not a single hormone issue. It is a system problem involving redox balance, mineral regulation, oxygen utilization, and metabolic resilience. Until those upstream constraints shift, insulin will continue to compensate and weight loss will remain inconsistent. If insulin were the root cause, these would have been resolved decades ago. Now, diabetes patients often avoid fruits fearing sugar spike. However, based on over decades of studies of clinical practice, I have observed that when fruits are consumed in appropriate timing and quantity, they do not increase blood sugar, but actually help regulate it. So I will not take much of your time, but I will just try to limit it here and then make another video for you to follow up. Otherwise, it becomes long and boring. So far, so good. My name is Dr. WAN. Thank you for listening and have a wonderful evening. Ciao.